Supporting neurodivergent students and staff in UK higher education through AI tools. The talk covers context around the project, what we've done, and what we found. The project happened in February of 2024. With the rise in AI use, there was a lot of concern and discussion around student misuse of AI, like with plagiarism, and around assessment design, but not a lot of talk about how AI can be used to help people instead. For example, with neurodivergency, which covers anything from ADHD to autism to OCD to dyslexia, etc. The prevalence of neurodivergency itself in higher education is difficult to determine, but what we do know is that students with a registered disability face poorer outcomes than their non-disabled peers at multiple points in their degrees. So AI could possibly help improve student outcomes and staff experiences. How? Well, we know that neurodivergent staff and students often struggle with executive function demands, particularly around planning, organizing, task initiation, and also face emotional barriers, like with stigma, perfectionism, and imposter syndrome, which can all get intensified with the fast-paced learning environment of higher education. Thus, AI can provide support by demystifying the hidden curriculum, with helping develop independence and autonomy, by supporting study strategies and facilitating improved engagement with feedback. The strengths of our research lie in that we take a strength-based approach. We want to support neurodivergent people recognize their full potential, meaning focusing on learning differences, not difficulties. We want to hear and learn from people with lived experience, such as members of our research team itself, which has helped with planning the project. There has been and continues to be collaboration with student partners, such as myself. And we also recognize that staff also need support, particularly neurodivergent staff. And we also recognize that there are intersectional challenges and that we need to help improve the experiences of all learners and staff members. Stage 1 encompassed finding out what tools exist out there and creating an AI tools list. Stage 2 was a survey that asked people how and if they use AI tools, what they like about them and what they don't. And stage 3 is about interviews to explore that in more depth. Here's a QR code to the AI tools list. We were successful in recruiting 61 people, mostly through Prolific, from the 23rd of January to the 15th of April 2025. We recruited staff and students who said yes to being neurodivergent, or some said prefer not to say, who were either currently working or studying in higher education in the UK. We emphasized that self-diagnosis was allowed in our survey. Most of our participants were women, most were white, most were students, and most were aged around 27 years of age and ranged from 18 to 62. ChatGPT, Grammarly, Gemini, Copilot, and Quillbot, as might be expected, emerged as the top 5 AI tools for academic and or non-academic purposes. ChatGPT as the most popular for academic and non-academic use, Grammarly as the most popular for academic, and Copilot as the most popular for non-academic use. The AI tools are most frequently used 2 to 3 times a week for academic purposes and 2 to 3 times a month for non-academic purposes, though both were the mode and there wasn't a lot of difference between them. The tasks that participants said AI helped them with was with writing in general, things like emails, writing structure, writing clarity, help with breaking down tasks into smaller chunks, help making decisions when facing decision paralysis, help with coding, help with explaining concepts, and with providing instruction and support with apps, and also just answering general curiosity. One participant said that they found I benefited them by helping minimize overwhelm and making the most of the capacity. In general, participants said AI helped by making tasks less tiring, so helping with organization, helped with productivity through saving time and energy, and facilitated better social interactions by helping with clarity and communication. Additionally, AI helped with supporting the hidden curriculum and by reducing self-consciousness by acting like a tutor, and it also improved cognitive load by providing executive function support. The barriers that were pointed out by participants were a general lack of AI literacy and uncertainty in how to communicate and prompt AI, concerns around biases in the responses given by AI tools due to the data they were trained on, concerns around ethics and rules of safe use, particularly concerns around data privacy, and a general fear of judgment and stigma for using AI. There were also financial barriers, such as paying for AI tool services, but also the concern that if the service was free, you were paying with your data. We asked participants in a perfect world what type of tasks or activities they want support with, whether it's something someone else can do for them or help them with to do faster. And participants said basically something that can act as their own fully operative and reliable executive function. So nothing new from what the AI already does, but just more of it. More interactive, uber personalized, saving time and cognitive resources, and providing external admin support and sustained attention. Now, what support do neurodivergent folk want that they feel there is no AI for? Our thoughts around this are that AI literacy can help with being a routine planner, acting as a reference and search engine, in time management, with things like creating a poster. It can help with workload. It cannot, however, help with workload, systematic inequalities, or things like psychoeducation. It also can't help with self-regulation, nor does it always provide accurate information. It's a tool, not a sage. Overall, neurodivergent people are using AI and finding it useful, and they're aware of the challenges AI use poses. It's important to have an open and honest conversation around AI use. Important to understand how it can help particular groups of people, and moving forward, important to understand more about the long-term impact of AI use. Like, is it closing the attainment gap, or is it being used as a crutch? We're currently recruiting for stage 3. If you would like to participate, please get in touch.